all the closings and cancellations, obviously a lot of concern about the coronavirus. I'm joined now by Molly Hyde. She's an infection control practitioner at GBMC. Thank you so much for joining us.
Thank you for having me. It's good to be here.
These are questions that you submitted to us on Facebook, so let's get right to it. What are the symptoms of the coronavirus, and how is it different maybe than like the common cold or the flu?
So the symptoms of coronavirus are very similar to the flu. The primary symptoms of coronavirus are going to be fever and then lower respiratory illness like shortness of breath and cough. These are very similar to flu symptoms. The common cold tends to have less severe symptoms, and they tend to be more upper respiratory symptoms, things like sore throat, runny nose, and not the fever that you typically see with coronavirus or flu.
What about the aches and pains that you have with
the
flu?
aches and pains are more typical with flu than with coronavirus, but you can see them in coronavirus as well.
Okay, so I noticed I was in the store looking for the wipes and all the stuff that everybody was talking about this week.
Of course, that's what everyone is in the store looking for.
How do you tell, how is it transmitted? I was noticed that everybody was walking like several feet away from each other, and if there was anybody coughing, you know, you kind of get away from them. So
it is transmitted by respiratory droplets. So somebody who's ill, coughs, sneezes, even talks, that can expose people who are in prolonged close contact with that person. It can also be transmitted by objects. So think something like a doorknob. So an ill person coughs into their hand, opens the door, then you go ahead and touch that doorknob and touch your face. It can be transmitted in that way as well.
So how long does it stay on some of these objects?
So we don't know exactly for this particular virus because it's such a new virus. We do know with similar viruses like SARS and MERS, it can last for several days on objects, but a lot of that depends on environmental factors like temperature and humidity.
Now, I know we have researchers right here from our state, a group in Bethesda, a group of women actually, trying to come up with that vaccine.
Yep.
Vaccines don't come quickly, so in the meantime, how is it being treated and how long is the recovery? Because some people are recovering better than others.
Yes, absolutely. So in terms of specific treatment, there is no specific treatment for this virus. There's no antivirals, and antibiotics are not going to help because it's not a bacterial infection. It's generally just supportive care. So if you're doing okay, if you're well, and you don't really need to go to a hospital, you can just stay home, drink some fluids, get some rest, and you should recover in a couple of days. If you are severely ill and you do need to be hospitalized, there are things that can be done at a hospital, like putting you on a ventilator in very severe cases.
And you see a lot of folks being quarantined. I mean, is that just an opportunity for you to get those fluids in and rest and relax? I mean, what role does that really play?
So keep in mind
other than not spreading it.
Yeah, absolutely. So keep in mind that quarantine and isolation are two different things. So quarantine is for people who are well. So that's going to be somebody who's exposed. They're not sick, but they have been exposed, so they're going to stay home for that 14-day incubation period just in case they become sick. They're not transmitting it to others. Isolation is for people who are sick. Home isolation is what you do when you're ill. You stay home, and that way you can't transmit the disease to others.
So if somebody thinks they have it, and you got all the signs and symptoms, I mean, what should you do? Should you just go walking right into the emergency room or the doctor's office? I would think not.
So no. So I like to say a good rule of thumb is if there's not a coronavirus outbreak going on, would you go to the ED for these symptoms? If you would go to the emergency department for these symptoms, if you really are severely ill, then you should absolutely go. But if you're just having mild symptoms, you really want to stay home, isolate yourself even from your family, and then go ahead and call your doctor, because oftentimes your doctor can talk to you on the phone and determine if it's something that warrants coming into the office. Again, there's no specific treatment, so even if you did get tested and test positive, you're not going to get any specific medication for that anyways.
So in terms of if you get it, we're seeing a lot more success with people who are maybe not immune compromised, and that's why is that population who's older and immune compromised so much more vulnerable.
Yep, so it seems to be really hard hit in the most elderly and in the older populations. We're really not seeing a lot of severe disease in the younger populations. We still don't fully understand that. For most respiratory illnesses, you see the harder hit populations being the very young and the very old. We're not seeing that very young population being hard hit with this coronavirus, and nobody is really sure why. There's a lot of theories out there, but the general theory is the older you are, the more comorbidities you have, and so that's why you get more severe disease.
Never seen anything like this.
No, this particular virus is brand new, but outbreaks of respiratory illnesses really aren't brand new. So we really do have a very good backbone for understanding how to contain it and what measures to take.
All right, Molly Hyde, thank you so much for coming in. I will not shake your hand. Don't take offense. I'm following the guidelines.
Yep.
Thanks for coming in for the latest.
Well, thank you for having me.
Oh, yeah, you're critical right now. For the latest on the coronavirus here in our state, download our WMAR 2 News app, and we'll send you all the alerts you need right to your phone.